So Regeneron's the only one that's been approved for that. So that allows you to get more volume, allows you to do it quicker, and hopefully be able to meet the patient demand for this. Now, in terms of the folks who are the most targeted for this, I mean, they basically say if people have an elevated risk of complications from COVID, that involves a number of things. If you're elderly, if you're immunocompromised, overweight, living with diabetes, kidney problems, heart, lung. And I would say if you're 50 or older, chances are you're going to be fitting into one of these. I think most Floridians would. And then obviously, if you're younger than that, you still may as well. So I would just say, anyone that has a better than average risk with COVID, if you do get infected, this is something you can do early and potentially really make a difference. And that really is the key, is the early intervention. When you get infected, most people obviously handle this fine, short of hospitalization. Body creates antibodies. Antibodies fight off the virus. People who generally fall into these categories, even some people, if you're immunocompromised and you're vaccinated, it helps, but it may still not be enough. So you get this antibody cocktail, and then that really goes to work fighting back. So if you do it early, there's a really strong record here. By the time this progresses to where you would be in serious condition, hospitalized, maybe even in ICU, at that point it's not going to turn it back. So the early treatment is really the key, and this has been proven to be very effective, not only in clinical data, but also just when you talk with people who have had it, it's remarkable. People are really, they feel really fortunate to have done it. I can just tell you on the sites we've done already, we've got a whole bunch of really good stories of people who got it, fever spikes, start to develop symptoms, they go in, and they've had resolution. A lot of them have had resolution very quickly. So we appreciate that, and we think that this is going to be something that's going to make a big difference. So 7 days a week, 9 to 5 here. We'll be doing some more sites, but as of now, we've got a pretty strong footprint throughout the state, supplementing what our healthcare systems we're already doing, and I think now there's definitely more visibility on this. More people are asking, and again, this is just one tool. It's not to the exclusion of anything else. This is for people. The fact that this is here should not mean that you don't get vaccinated, but the fact that you're vaccinated does not mean that you may not get infected. I think we're seeing more and more breakthrough. So one thing I can tell you, though, in terms of the data, pretty much every hospital, I'd say it's a minimum of 80% of the patients that they admit for COVID are not vaccinated.